I hope you enjoyed that extra hour's sleep last night. I know I did. For sure, man, I was out like a log. What a great day we had yesterday. And listening to all the different comments as we went through the evening, it was just so heartwarming and just so great to feel the love that's here and to feel the love that's out there online. It's just been an amazing 24 hours for sure. So we have a really great day planned for you today. We're going to kick it off with a little segment that Michele and I and Dr. Kohlmeier are going to chit-chat a little bit about what's going on in the organization and potentially do a little shameless volunteer plug and a little shameless fundraising plug for you guys to be able to continue out through 2025. I did want to just do one announcement really quick. When we go on our first break today, if you're checking out today, you do need to bring your luggage down, and you can put it where we had the registration yesterday, and it'll be perfectly fine there. So, yeah, without further ado, I want to get us kicked off. We're going to just kind of sit here and chit-chat a little bit, and we'll be open to potentially a little bit of questions at the end of it. So, go ahead.
Good morning, everybody. I'm Lynn Kohlmeier, and I'm chair of the Medical Advisory Board, and I just want to give Michele and Patty a standing ovation for everything they do for us. We couldn't do it without them. And I love how the camera is always kind of looking at you guys, and it's just been so fantastic. And the Medical Advisory Board and all of the staff for HPA, and we would love more volunteers and our friends, family, patients. So I really want to thank you guys for all you do. And we'll
Thank you so much. Going to make us cry to kick things off here. Lordy be. I got to hold on here. I'm a twisted. Okay. So what we thought we would do.
Chairs are not made for short people, y'all.
What I thought we would do is talk a little bit about what we've done. We post a lot online. We post it on the website, and we share that. But it takes a lot to be able to spread the word and to be able to help people understand what hypoparathyroidism is and why we need the community, why we need the industry, why we need the researchers, why we need everybody involved. So this last year, I have to say our biggest, if we had to say our biggest accomplishment this year was the PFDD. And I think that from that perspective of being able to get in front of the FDA to really help them to understand not just these symptoms that are on paper, or we need this drug because we need our lips to quit tingling or whatever, but about the effects of our daily lives and how it's stifling our daily lives. So it was a huge undertaking, and this one, Michele, she took it on. She kept talking about it for a couple years, and she was like, we got to get it done. I'm just going to pull the plug. We're just going to get going. So she went in, and neither one of us knew like the process or whatever to get this going. So it was a lot of research and time spent to learn to do it. So I wanted to open it up and give you a few minutes to talk about like lessons learned in the PFDD and what you feel super proud of, because she worked her tail off to get that done.
Thank you. For those of you that don't know, real quick, we keep throwing around acronyms. PFDD stands for Patient Focused Drug Development Meeting. And when I started the project, I kept hearing that it was ultra important if you don't have a drug for your disease that you have one of these meetings. But I had no idea what I was getting myself into. And in my beginning research, I kind of thought it was one thing and that our endpoint was and our goal was just to get a drug. But it's so much more than that. And not just through my research, but once you do your initial letter, which I have to thank our Medical Advisory Board for, because they helped us write our letter of intent to the FDA. And when we got that approval, it was very exciting. But I still didn't really know what it was we were going to do. But the FDA then assigns you a team of people to work with in the department that you're asking for this meeting with, because the FDA is divided into many, many different departments. And ours was the CDER department, which has to do with endocrinology and so forth. And to make a long story short, they helped us see that there was other endpoints to this meeting. And along that journey, I also learned that it was about the journey, and that what was going to be created from this PFDD is something called the Voice of the Patient Report. And that lives on forever on the FDA's website. And they said that academia and researchers will access that for all of time to figure out, what does hypoparathyroidism really look like? How does the patient journey differ from what we see in textbooks? So then my goal became, how do I really make that patient journey pop? And part of it is, the key is finding the right patients, and not finding the right patients in the aspect of finding people who are excellent speakers, or I don't mean it that way. I needed to make sure that we represented our entire patient population. So that became my biggest goal last year, was I needed to make sure I represented people on standard of care, people on off-label, people on clinical trials, people that were genetic, people that were idiopathic, people that had autoimmune, which we don't hear that much from. So our panel was made up of a couple of different genetic types, post-surgical types. We had an APS1 patient, and for those of you in the room who don't know that what that is that's an autoimmune disorder where hypoparathyroidism is a key signal in that disorder, but it's not the only thing they have. So it was neat to see how their journey differed from the rest of hypopara patients. But I thought we needed to see that. We needed to see the differences in all of us, but yet that we were all the same in some way. So that was a great part of that journey. And if I can take just 2 seconds here, we have almost half of our PFDD panelists in the room. If you would all just give a little quick stand up. I cannot thank them enough for their speeches. These are our panelists. We had 13 total, and we have 6 in the room. So thank you guys, because without you, we wouldn't have gotten our message across.
Absolutely, and they spent so much time practicing and getting ready and understanding what they needed to do. So we really do appreciate all of you for that. So Dr. Kohlmeier is the chairman of our medical advisory board. So when you think about doing the ELPFDD, it makes an impact on the medical community as well. And I know you watched it and felt really great about it.
Absolutely, I was part of it, and mostly listened and added some of our experience as providers. I think that our education, and you guys know this because you're trying to educate your providers, I think it's really important. It was very helpful. If it wasn't for that and your working with all of us and industry, I don't think that we'd have our options as soon as we are.
And I want to make another quick reminder that Voice of the Patient report I talked about is about to be published, and it'll be up on the FDA website within the next few weeks. It is finished. We worked with a scientific writer all year to get that done. And I want to give one more thank you out to Dr. Rubin, who's in the room, who was our medical expert that spoke to the FDA that day. Thank you, because without you, we wouldn't have been able to, tell them scientifically what our signs and symptoms are.
And Dr. Manstadt had to leave, but he was there as well and able to speak to them. And then we had the chief of endocrinology from the FDA that was there as well. So she spoke about it, and she was sincerely touched to understand what a hypoparathyroidism really was. So it was a great event that'll go on for years and years, and I had the fortune to moderate it because we're a nonprofit, so we don't have bankrolls running out the door. So we had to figure out, how do we do this financially, because it's very expensive to do something like that. And luckily we had this amazing team, the AV team, that worked with us and helped us, coach us as well to get through it. But the moderation part of it, you had to go back and really learn, watch hours and hours of videos to understand how do you even moderate something like that. So it was a great learning experience. We felt really proud of it, and we hope that it'll really make an impact for years to come. So the next thing, one of the biggest things we did this year was we were asked to participate in a parathyroid summit These were with experts around the world. Oh my gosh, it was like pretty amazing to be a part of it. And I will admit I was slightly intimidated at the beginning of it because I'm like, oh my God, these are like experts. Like, I feel a little bit weird. I don't know this medical stuff. Sorry, Michelle, I have to keep moving. I'm twisting. Yeah, it was wonderful because the clinicians want to understand a patient perspective as much as they can. So being able to be a part of helping to update the guidelines on how do you treat hypoparathyroidism patients was just such an amazing journey. We started it in, February, and the actual summit was in June. So we had regular meetings with that, and it was definitely, I felt like we got our voice across to
Definitely,
the experts.
like you said, that first meeting, we had no idea what to expect, and we were on there with these 28 amazing physicians, and Patty and I were like, we're just here to listen, right? They don't and then they started asking us questions, and a couple of times I, voiced my opinion because I'm known to do that, and it was great because I did that, and then I was kind of like, maybe I shouldn't have said anything, but there was this one doctor in particular, and he, like 20 minutes later, said, no, he said to Dr. Schobeck, he goes, no, Michele had a really good point a little while ago. I think we should go with that. And it just made me feel so validated. Like they really do want to know how this looks from the patient's viewpoint.
Yeah, we get our information. So we have our stories, obviously, because we're patients. But, we're online with you guys. We're listening to you. We're understanding. That's how we created the agenda that came up for these 2 days. That's how we represent when we go out. When you see us out and about, it's not about like Michelle's story or my story. It's about everybody's story collectively. And we do share, of course, we don't share names, but we do share your different instances that really stick out. So being active online with us, whether it's sending in something to admin or telling your story online or being part of our socials, we do take that and we represent you with that. So it was really great. And at lunchtime today, you'll hear from Dr. Khan, who is going to talk about the updated guidelines that were created and should be published in the next couple of months. So that's great to hear, and it's just kind of funny. The lady from one of the doctors, I think she was from Italy, she's like, don't worry, the patient voice is heard. They were loud and clear. So it was really nice to hear her say that as well. So we try to represent and put our voices in there as much as we can. So I told you this 20 minutes is gonna go by super fast. So of course we did endo, which was fabulous. We get out there, we put this lovely booth up, and we talk and talk and talk and talk and talk for days. ASBMR, same thing, but this year we were able to do CME classes, so that's continuing education for the medical providers. And during that, again, a couple different sessions we were invited to do, they allowed us to share our story, a piece of our story to be able to set up the day or set up the class that they had that then gave them the medical information. So, I mean, it was pretty powerful. People came to us at our booth later. They came to us, throughout to really say, wow, they understood it as well. Again, the goal is to get in front of as many clinicians. I don't know how many times we hear you guys say, my doctor just doesn't understand. They don't know. I'm their only patient. We know there's 8,000 endocrinologists out there that we need to get in front of, and we need to say, hey, listen, this is what's going on, right? This is what it's like. So doing these continuing education classes, everybody has to have a certain amount of hours to keep their license up every year. So this is a segment that they can then go on and listen to the patient voice and the facts that go with hypoparathyroidism. Anything else for that?
Not for that, yeah. I mean,
I can add to that. I think another great way to educate our providers is through the virtual CME echoes. And they've been going on for almost a decade, but of course, COVID really increased the use. of this way for doctors. They're all different times a day. There's rare bone echoes, there's bone, osteoporosis focused echo. And our West Coast echo is every Wednesday, first Wednesday of the month in the evening. And so I really reach out to all the providers and say, come learn about HypoPARA, and then they can get their CME. And we present a case every time, all HIPAA compliant, of course. But then, they can ask questions. And sometimes when you're an expert, or you're supposed to be, and you really don't know something, it's hard to ask questions. And so that's a venue where it's just great, because you see experts asking each other, and that's, kind of what you guys do as experts. But providers need to do that too, so it really is great.
Very good. All right. So let's see. Just a couple more things I want to touch on, you guys. Recently, we just started doing the Medicare hearings. This is super important, and to get to every single state is going to be like a lot. And this is, while we're doing it now, we're going to have to continue to do it as different drugs come up and stuff. So we'll always be looking for volunteers. We need to help you condense down to a 3-minute quick story, because they certainly have a clock on you when you're doing that. But what happens in these, and I feel very passionate about this because we just did one a couple weeks ago, and when I heard the hearing describe what hypoparathyroidism symptoms are, I was like, are you kidding me? I was ready to jump through the phone. I needed to, like they talked about tingling lips or tingling hands. Okay, well, anybody can kind of live with that, right? But what is our daily life like? So the 3 minutes that we had, Michele was able to tell her story on the impact of what those symptoms really are, to where what they originally described to what they really are was like, oh, right? So we really need to be a part of that. So we'll be looking for volunteers. We will help you craft your 3 minutes, because it goes by super fast. We'll help you craft that. You can just tell us a story, and honestly, I'll write it or throw it in Chat GPT, and we'll figure it out. That we'll be able to help be very pointed and get our word out there across the board. Can you share a little bit about why it's important for these Medicaid?
I was going to say, so just so you understand what these are, they're called a DUR, Drug Utilization Review Meeting. Every state has one when a new drug is getting ready to come to market. And the point of the meeting is you want to get the drug put on the state's what's called preferred drug list. You may have heard that term regarding your own personal insurance. Every insurance has either what's called a preferred drug list or a formulary that they put drugs on. Every state has that for Medicaid and Medicare, okay? And it's kind of a known thing in the pharmacy world, and I don't mean like pharmaceutical company, I mean I work in a like retail type pharmacy, to know that whatever Medicaid and Medicare does, a lot of payers kind of follow along, So it's very important that we get to these DUR meetings and get the drug on their preferred drug list so that people will want to pay for it. Because if it's not on the list, it doesn't mean they won't pay for it, but they're a little more likely to give you a hard time about it. So we go, they gave me 3 minutes. I thought it was just 3 minutes and nobody was really keeping track. No, they put a clock on the screen and it counted down. And when it got to 6 seconds left, I might have started to panic a little bit, like, am I going to finish? But I got my point across. But the difference was, they said they might get some tingling, they might get some numbness. And I was like, oh no, let me tell you what it's really like. But that's important that we get across how it impacts our lives. And I was also able to share a little bit about the difference between standard of care and how I feel now being on a PTH therapy. I think that's ultra important, so that regardless of whether it's Yorvipath or Calypso or some drug 5 years down the road, we need to start setting a precedence in every state in the United States that this is necessary.
Absolutely, and some of them actually require you to be in person in the state, and of course, again, nonprofit, we're not going to be flying all over to these different states to be able to do it, and especially because they're always kind of last minute. like a week before, if we're lucky, for that time frame.
So Patty, on that note, we might need a volunteer in every state.
Yeah.
Well, as many of you that are willing to step up and put yourself out there, email Patty or I, and we would be happy to get you on the list. Most of them are going to happen probably between January and March of next year. There's a few that are happening this year. We can handle those few, but we're going to need to get people on board. And you don't have to live in the state that they happen in if they're virtual, just like I talked for the state of Washington. Anybody can do it.
And it can be written out, and you just read it straight off there. It's not like a big presentation or anything. It would just be that patient voice. So we are out of time. I just want to zip it up here with really what God, 20 minutes went fast. What we have planned for this next year, of course, all the things that we've already talked about, we will continue on. The one big ask that we're going to ask of you guys is we need to get our registry going. We had a registry before that we had a minimal people join on, but we found out after we met with the company it was probably not the registry that we actually needed. So we'll be making a decision by the end of this year of which registry. We've been in talks with several of them. But when we get it, we do beg of you to go on there. We need to understand who our patients are, where they live, what kind of hypoparathyroidism they have, so that we can help support research, we can help support science. Of course, your name isn't going to get disclosed out there to anybody, but all the different things that they would track, we definitely need to do. So we'll be asking for help from that.
And we'll make sure that it's straightforward
Yes.
and clear and
Yes.
that your information's safe.
And it'll feel about hypoparathyroidism, not about 5,000 other diseases that they have out there. Let's see, we'll be doing CME for clinicians. This is a big thing. We're going to try to take on supporting ourselves, being able to host a CME from the HypoPARA Association. We're going to be collaborating with other nonprofits of hypoparathyroidism in other countries, so that's exciting. And then really getting more involved with these biopharmas, pharma companies, to be able to help them completely understand as well about hypoparathyroidism. So we need volunteers. We will train and help as much as we can to get people. We have to learn a lot ourselves, so it would be learning together. So we'll be looking, if you just want to send an email to admin@hypopara.org, or we have a volunteer button on the website.
There's a volunteer form you can fill out on the website, and you can let us know what areas you're interested in, because we're also going to need other advocacy type things. And advocacy means many things. I can't go into it today, but if you're interested in what you think advocacy is, reach out to me and I'd be happy to have a conversation with you.
In addition to funding, it's always hard to ask for money.
Yeah.
It's one of the reasons why sometimes we don't do certain things. We don't want to ask other people for money. But being a nonprofit, any kind of funding you have, if you have other friends or family member that you think would donate. And one of the important points was, and all the caregivers here and friends and family, what you're going through as a patient is hard for you, but sometimes it's even harder for your family and friends. And when you're feeling better, especially when you're on parathyroid hormone replacement, in my opinion, they can relax. And so if you know family and friends that could donate, please do.
Absolutely. Thank you so much. Yeah. Yep. So we have our donate button on the website. You can become a monthly volunteer or the donor. If you choose, or one time, however you want to do it. And certainly reach out to your family and friends. When we put social posts out there, you know, kind of talking about Giving Tuesday or whatever, share it out with the world, see what you can do, see how you can collect for that. Because in our last edition of the newsletter, you saw we put in, did you know that costs this? Did you know it costs that? What was it for the PFDD, like 80?
The PFDD was over 100 grand to put on.
Just to do that. So, and you have to, it's not like wasted money. We're definitely very frugal with our money for sure. So, all right, that's it for this segment. Thank you so much for listening, and we'll get ready to queue up our next one.